my name is Megan Smithmyer. I'm a staff scientist here at Benaroya Research Institute, and I'm the first author on our recent Science Translational Medicine publication, Longitudinally Stable T-cell and Innate Immune Cell Activity Distinguished Healthy Adult Immunotypes. I'm here in the BRI biorepository where we store samples across our 11 different registries, all focused on a different type of autoimmune disease, and where we're storing samples from the Sound Life Project. The goal of the Sound Life Project is to characterize the diversity of healthy immune systems. People sometimes think that healthy people are all the same, but that's not really true. Healthy people can have different responses to an infection or a vaccination, and it's important to characterize that diversity so then we can compare healthy people to people who have something like an autoimmune condition. The Sound Life Project was a cohort of 100 healthy individuals enrolled in 2 age cohorts, 25 to 35-year-olds and 55 to 65-year-olds. They completed 10 visits over 2 years, so they came in roughly every 3 months. At each one of those visits, we collected cytometric, transcriptomic, and proteomic data. In addition to that, each participant kept a journal of their health, so they informed us whenever they had a disease, like a cold or a rash, and we also collected some information about air quality, where they were, and their step count. In our recent paper, we described 4 different immunotypes that we found in the Sound Life Project. Immunotype 1 was made up of mostly younger participants who were mostly female and mostly CMV negative. Immunotype 2 was an even mix of younger and older participants, also an even mix of female and male participants, but mostly CMV positive. Immunotype 3 was both male and female and mostly CMV negative. And immunotype 4 was mostly older participants, both male and female, and mostly CMV negative. These immunotypes were based on cytometric data, but when we incorporated the transcriptomic and proteomic data, what we found was that the immunotypes were really defined by differences in T-cell activity and innate immune cell activity. For example, immunotype 2 had higher levels of T-cell activity, which was probably related to differences in their T-cell frequency, which are known to be associated with CMV positivity. Immunotypes 1 and 4 had higher levels of innate immune activity. Innate immune activity is known to increase as you get older, but it wasn't clear why immunotype 1, which is mostly made up of younger female participants, also had increased levels of innate immune activity. We will be following the Sound Life Project participants over time so we can understand how people with different immunotypes age and how they might be at risk for different health outcomes. I think this work is really emblematic of the work we do here at BRI, which is to advance the science and to predict, prevent, reverse, and cure diseases of the immune system. By understanding the diversity of healthy immune systems, we can better understand people who are at risk for autoimmune disease or maybe developing an autoimmune disease. We want to thank the Allen Institute, who are our collaborators on this project, and of course the participants in the Sound Life Project. This research really highlights the importance of your contribution to science and the lasting impact that you will have.